Knowing the signs of a stroke can mean the difference between life and death.
Yeah, in tonight's Wear the Gown, Eyewitness News reporter Jeremy Baker explains the symptoms and what to do in those critical moments.
There are two types of strokes: ischemic strokes, which make up the vast majority of them, involving a blocked blood vessel not allowing blood to flow to the brain, and hemorrhagic strokes, which involves bleeding in the brain. But for both, you want to remember the acronym FAST, or F-A-S-T.
FAST, is an acronym with the F standing for face, because patients can get a facial droop with a stroke.
Dr. Justin Massatelli is a neurosurgeon with University Health. He says the A stands for arm weakness, S is for speaking and trouble forming words, and the T stands for time, which is extremely important.
There's only a certain amount of time that we can give the blood thinner, so that's only 4.5 hours.
That blood thinner breaks up the clot, returning blood flow, but it needs to be given quickly.
As every 10 minutes goes by, millions of neurons are lost, and so the faster patients can get in for treatment, the more likely they are to have a successful outcome after treatment.
Additional symptoms of strokes that are not as common include sudden confusion, sudden numbness, sudden trouble walking, sudden trouble seeing, and a sudden severe headache.
It's actually important for the people around the patient to make that identification and call 911 immediately. So if you see a family member or a friend who's not acting correctly, their speech is off, or they seem weak on one side of the body, it's imperative to call 911 right away.
University Health was one of the first to adopt something called IV Tenecteplase as a frontline blood thinner for stroke patients. To learn more about it, we have more with this story on KENS5.com. Jeremy Baker, KENS 5 Eyewitness News.